Okay. Hi there.
Hello, everybody. Hello, Iran.
Hi,
Ukraine is
Igor.
on the line.
Yes, awesome. This is the most amazing thing, right? It's Ukraine and Canada, Edmonton, and we're gonna talk about shockwave therapy today.
Not only Nokia connecting people, even shockwave connecting people as well in different places and different countries. Iran.
Yes.
I know you are an experience in shockwave.
Yes.
Can you please tell a few words briefly for 5-6 minutes? What is shockwave for you and how did it change your professional activity?
Honestly, as the word it sounds, shockwaves, it is shockingly, amazingly, it's mind-blowing. Okay. So when I say that, it's for me as a practitioner because it gives me the tool first to reach anywhere I want in the body, deep enough, but without hurting any cell, without causing any side effects, without causing any collateral damage. And as many people know, shockwave therapy is first used to break up kidney stones in 80s, and it started in Munich, Germany. And as they were doing kidney stone treatments, they realized that there was actually a bone regeneration happening on the pelvic bone to those people. And that's when they start learning, it's like, oh, there's something more than just breaking down kidney stones. There's some kind of regeneration happening in that area. And then since then in 90s they start trying to treat calcification of the shoulder with shockwave, trying to break down calcium buildup. And then they realize it's like, oh, it's not really breaking down the calcium right away, but after a couple of months the body is cleaning up the calcium. And now we are in 2022 and shockwave it's used for treating pretty much anything that is musculoskeletal chronic pain conditions that literally people try everything else, and if nothing works, then they get shockwave. So, and then they use it for men's health, for erectile dysfunction. They can use it in aesthetics, for heart regeneration we have seen now, and even for brain tissue and Alzheimer. And so this is where we stand today. But on top of that, we have this big confusion in the medical community and practitioners, and even for patients, that there's a lot of other devices that sounds like a jackhammer. For example, this one here, I have it on the back, like this device here.
And I have the same device like you.
Yes, like this
there
one.
You go.
Yes.
There
so,
you go.
Yeah, that's awesome. So yeah, this is what everybody calls it, shockwave, but in reality, this is not a shockwave. So this is a kinetic pressure. It's a radial pressure wave. It came in 1999 for the first time in Switzerland. It's still really good. It works to break down the superficial scar tissues and adhesions to relax the muscles. So it's more a tissue treatment. But where you get the breakthrough, where you get the most of the effect, and when you get the true shockwave is when you do this kind, okay? So what they call it, the focal shockwave.
There you go. I'm going to show you the same device.
Yeah, look at that. It's exactly the same. Yeah, so we're shooting from one side of the world to the other, right?
Absolutely, in different countries.
Yes. So when you combine those two, that's where with a radial pressure wave, you kind of open up the pathways, you relax the muscles, and then with a focal shock wave, you stimulate angiogenesis, which is completely new blood vessel growth, some stem cell activation, and that's how you get the healing going. So wherever you are, whether you're in Canada, Ukraine, or around the world, if you're truly looking for true shockwave treatments, then you have to look for places or practitioners that combine those two, or like even just the focus.
So let's make the clear statement that that device that you showed before, which is radial pressure wave, this is not a true shock wave.
Correct.
This is a commercial name of the product.
Yes.
Nobody says it's bad, it's good, but it's only for superficial indications.
Yes. And the reason actually, Gore, why it's so popular, because it's so much cheaper. Cheaper it's to buy it,
Absolutely.
cheaper it's the maintenance. And so that's why everybody's just like grabbing it. And then they like to use, you know, the science, the evidence of the shockwave and claiming that they're doing shockwave, which is sad, you know, because patients need to know the difference. They need to know the reality. And again, don't get me wrong. Like there's a saying that if there's no rain, hail, it's good too, right? But they're completely two different things.
So, and the second statement, if we combine focused and if we combine radial, it's even better to use all these type of shockwaves together.
Yes, exactly.
Do you agree?
Exactly. Yes, I fully agree. See, here's the thing. There's another saying, with one flower, summer doesn't come. So even when you have a problem in the body, it's not always one single thing. It's a combination of multiple factors, compensation, and a lot of things that brings the body to that point that you experience pain. So now, when it comes to the treatment, you have to use the right tool for the right time and the right tissue. So if the problem is more superficial, you can go and use more, you know, the radial pressure wave. But if the problem, let's say it's in the joint capsule, you have a shoulder pain that wasn't going away for months, radial pressure wave is not going to be deep enough to go and release the deep structures. That's why you need the focal to get in there and stimulate the regeneration from within. So when you do radial pressure wave, you're stimulating healing more from the skin towards the bone. When you do the shock wave, you stimulate healing more from the bone towards the skin. So that's how they work together the best.
Can you tell me and my audience how many sessions in general do you usually do for general indication? We are talking about general.
Yes.
We are not
See,
talking...
general indication. This is my approach when it comes to shockwave, and then we can elaborate if you practice the same way. So I like to go minimum 3 sessions, maximum about 5 sessions. So that way, it's like you do a session once a week. So minimum that you have to wait in between treatments to let the body respond after shockwave is 3 days, maximum 15 days. So you do 3 to 5 sessions, depends on the condition, depends on the pain level, depends what you're treating. And then you allow the body to heal for 4 to 6 weeks after that. In that time, you can still help it with other therapies. Let's say you can do laser, you can do exercises, you can have, you know, nutrition, anything that you can help it with, it's amazing. So shockwave, you have to understand it, it's almost like you're planting a seed of regeneration. And everything that you do on top of that after, that's more a fertilizer. So that's how you can help the body to fully regenerate.
Do you give your patient advice when you completely finish with them to wait at least 12 weeks, which is equivalent to 3 months?
Yes.
To expect the full resolution after the treatment?
Yes.
Or you expect your patient to be pain-free whenever you finish with them?
Yeah. See, when pain changes during, so there are 2 parts when it comes to shockwave. So you have the treatment phase where you're actually removing scar tissues, adhesions, you're cleaning up what has caused the body not to be able to heal itself. Okay, so that's more the treatment phase. And during the treatment phase, the range of motion can improve, the pain can decrease, but that doesn't mean that the tissue inside it's healed yet, because it takes about 4 to 6 weeks for the body to create the new blood vessels after the shockwave, to create the access, so then the body can actually have new capillaries in the area and start bringing the stem cells to repair. So therefore, first 3 months after the shockwave, that's considered the healing phase. It's almost like surgery. You know, when you get done the surgery, you're gonna feel after that sometimes way worse, right? And the effect of the surgery, you see it way later. So here you're doing surgery without opening the body without killing any cell, you're changing the environment inside
and
for
without
good.
any damage.
Exactly. Like literally, you don't kill even a single cell during the procedure. So yes, so you have to get the treatment, wait for 3 months, and in 3 months you can actually judge and see how much it helped you. And the other thing, Igor, that I see with my clients is that people get adapted to the change because the healing comes within. So people think they get up the next morning and then it's like, oh, it doesn't feel as different. But then they go for a walk or do their things that before they could not do, or it gave them pain. And now they see it's like, oh, it's not as painful. So you always measure the results when you go and do your routine, because that's when you can tell the difference. If you just judge based on the pain level, there could be a million things. You could have been more stressed. You could have had like food that causes more inflammation. You could have done a little bit more than usual. So therefore, look at the overall. That's what I tell people when I treat them with shockwave.
Did you have cases in the past that you didn't help the patients, unfortunately?
See,
because people, sorry that I stop you, everyone is happy to show the good and successful stories.
exactly.
There are situations then you can't show the happy story because
Yes.
not that you are not professional, because somebody's problem can't be treated that way. So
Exactly.
can you tell something about it?
Yes, honestly, I've done over 50,000 treatments with shockwave therapy. Okay, so I've been doing shockwave daily. I have 2 clinics in Edmonton, and we have a group of people that do other practitioners, and not everybody, can benefit from it or have those amazing results, because the first thing is about the cause. What is the cause of the pain and the problem? So if you treat the cause with a shockwave, where the pain is coming from, then it obviously is going to help. The other thing is, if the problem it's been for a very long time, it's been years, and now you just started to take action because pain is literally killing you, it's like it's so bad, and you're expecting all that change, that doesn't happen right away. So yes, I have had cases, where I've treated people with lower back and it did not help what I expected, because there's multiple factors on that. It's again what they do for living, it's like how much they're active. There's multiple factors that contribute on that. But the good thing is that shockwave doesn't cause side effects. So if it can help you, it will help you, but it cannot make things worse. That's the good thing.
Do you explain to your patients that you can cause some of discomfort or inflammatory process, which
Yes.
is absolutely controlled by you?
Yes, yes, yes. So
the patient may feel some unpleasant feelings or pain after the treatment. This is
correct.
the normal reaction of the body.
Yes, yeah, because here is the thing, Igor. Every time when human body goes through a change, so when you get injury, you're actually changing your body internally, and that's why your body is going to respond with pain. So pain is a signal that is just telling you that you have a change inside the body. When you get the shockwave done, you're literally causing a false injury in the system. So when a mechanical sound wave goes through the tissue, your nervous system, your brain is going to think, oh my God, we have an injury inside. Let's mobilize the cells. So it actually brings that local inflammation. So the first 3 days, 72 hours after the shockwave, you might feel worse. You might experience that. But then after that, things start actually getting better because you have initiated change. So what I tell to everybody is like, I want to see either improvement or worsening after the shockwave treatment, because we know that we're making a change and we're making a progress.
I tell to my patients, I do feel happy when they come to see me on an ongoing visit. And in 2 cases, when they say, oh, I'm feeling worse or I'm feeling better, because
exactly,
I've got the feeling that things are getting in accordance to plan.
Yes. Like what you're doing, you're changing the status quo of the disease, of the problem. So every time when you touch the painful area, you're almost opening the Pandora box. You know, you're opening all the problems, and then body has to go and realign and come back to where it should be. So pain and being sore, it's very, very, very normal.
Do you agree with the statement that shockwave is not a quick fix?
Yes. So shockwave is not a painkiller. One thing that you have to know, it like the effect of the shockwave to reduce pain is just one of the effects. Shockwave, it's a regeneration therapy. You're not putting anything artificial in the body. It's just stimulating your body to do the work. So imagine if something is injured, your body has to bring a lot of cells to repair that, and that cannot happen overnight. It's going to take weeks. So if you actually think that shockwave is just you're going to get shockwave just to treat the pain, no, you're going to get shockwave when you truly want to heal yourself. Like that's what I tell people.
So shall we say the shockwave is not a symptomatic therapy, it's a therapy which creates regeneration.
Yes.
And it is designed to have a prolonged effect or long-term effect in the future.
Yes.
So whenever you tell your patients that you will be better within 3 months, this is true. Correct. Can you just prove what I just said?
Yes, I 100% agree with you, Igor. And this is not just us talking here. This is scientifically proven. I've seen during the International Society for Medical Shockwave Treatments, they have measured with ultrasound up to a year after the shockwave treatment, there is still actually stimulation in the regeneration. The first 3 months, that regeneration is very powerful, it's very active. But even after that, it still continues inside. So, and here is the thing. So you do the initial protocol, person gets better, but there is still something lingering around. There's still, like they feel, let's say 60, 70%, 80% better, but still 20% is there. You can still get shockwave. But what you do the initial phase, you let the body heal, and then if you need it in the future, you can actually treat that area again to boost more healing.
How do you think about the influence shockwave of herniated disc? Because my personal belief, it doesn't help herniated disc at all.
See, I have completely different perspective on herniated disc myself. Okay, so I want to talk a little bit more about this, because imagine this. Vertebra, it's protecting spinal cord, which is like pretty much like same as your skull protecting your brain. So you have those bone protecting that area. So if your body, for whatever reason, because you weren't active, you got injured, you were lifting something bad and all that, moved all that impact to the vertebra region and injured the herniated disc, it means that the problem now is not just with the herniated disc, it's with all the structures around it, okay? So when you do the shockwave, and there's Thomas Nedelska from Czech Republic, who has done a study specifically with shockwave and herniated disc, where he went and hit exactly where the herniation is, and that helped. Like you have seen really good results. But when you do the shockwave, especially the combination, you're going to actually change the muscles around the whole spine that are stabilizing the spine. So you're not going to help just like where the pain is, but you're going to treat the whole region, and that's where it helps more than anything else. I have clients daily, like I just want to tell the story of this 24-year-old person that had MRI and was diagnosed with herniated disc, and they wanted to do surgery in him. And the guy literally stopped doing he didn't work, he didn't dance, he didn't do any sports, and he was very active prior to that. He came to the clinic, and they said to him, the only option that you have is surgery. And I said, no, you're still extremely young. You're 24. It's like, there is ways that we can help. So what I did, I went and I treated hip muscles, like both hip muscles. I treated the lower back, like muscles that go along the spine.
But,
And then
but please mention that you've been using focus shockwave.
Exactly. No. So with a radial, you cannot even get there, right? It's a focal shock wave that goes 12 centimeters deep, and it releases those deep muscles that there's nothing else that you can release it with. Like the only way to go that deep, you have to cut the body. So that's why shockwave, it delivers like the true shockwave. The focal shockwave goes that deep and releases those structures, stimulate healing, stimulate new blood vessel. And when you have more blood circulation around the herniated disc, you're bringing more oxygen. So you're actually helping the spine, the vertebra, to decompress in natural way.
Yeah, you probably misunderstood me.
Okay.
I mean, when you are using focus shockwave, yeah,
Yes,
you don't put straightforward influence on the hernia.
Exactly.
Because you've got muscles, ligaments,
Exactly.
bone here. The
Yes.
sound,
it's going to reflect. Yes,
wouldn't even touch the hernia.
Exactly.
But the effect which you are trying to put on the muscles, on
Yes.
the ligaments structures, will be influence on the herniation.
Exactly it. Yes. Yeah, because here's the thing. When it comes to a problem, it's not only one factor. When you
Absolutely.
have herniated
It's
disc, you don't have
multifactorial
just
problem.
herniated disc. You have a muscle problem, you have tendon, you have nerve, you have ligament, you have fascia. So you have to treat
I would
all
like
those
to
structures.
ask you about that patient. Has he had any signs of radiculopathy?
He had, yes, he had, and after 3 sessions, he's completely pain-free. He's back to dancing. He's back to doing all kind of stuff, like even playing soccer. And
But
it
did you
did not
explain
happen
to
right
him?
away. It
Did
like
you
I did.
explain to him?
Yes.
Did you? Sorry that I'm stopping.
No,
This
it's all
is
good.
my nature. Did you explain to him that he is not completely healed yet?
True.
Even the fact that he's pain-free, the regenerative process is taking place in his body.
Yes. Because here's the thing. You can only help the body and give the tools to heal. But the healing, it's going to depend on the body. Like whatever it's injured, the cell, so that's still going to take place. So yes.
Do you agree with the statement that as younger body, as much help or support you can make with the shockwave?
So you mean more like the younger the person, the better the effect?
Absolutely.
Correct. Yes. Because here's the thing, the biology, it's you know, it's younger. The cells are younger. So on older people, the effect, it takes more time. It's less. And the other thing is, it all depends how you take care of your body, because your age and your biological age inside are completely two different things. You can have somebody that is, you know, young, but they don't really take care of their body. Like inside, they're not as young as what their age are. So you have to think that perspective. And then you have somebody who is in, you know, 70s, but they're active, they're taking care of their body, the muscles, so they're going to respond really well from the treatment. Like my oldest current client that I treat with shockwave is 93 years old. So age doesn't matter.
Congratulations.
Yes.
Can you explain to my audience that existence of the heel spur, this is not the cause of the pain?
Exactly.
The problem is in a soft tissue, which is called
Yes.
plantar fascia.
Yes.
Because majority of my patients who are coming to me, they expect me to distract the heel spur, which is
No.
physically absolutely impossible. It takes time after the shock wave, after the proper shock wave, focused one, to dissolve that heel spur.
Yes.
And
So,
there are a lot of cases when the heel spur can be dissolved, but there is no pain. So the presence of the heel spur is not always the cause of the pain. Just prove my statement.
Exactly, Igor. So I want to actually, this is a study that International Society for Medical Shockwave Treatment has done. Example, turkeys, you know, the bird, the turkey, their legs are fully calcified and they have studied them. They don't have a pain. So if you have a calcium buildup, if you have a spur, that doesn't mean that that's where the pain is coming from, because you see it on X-ray and you have the pain from outside in the same area. That doesn't mean that it's coming from there. So the pain in all those cases, it comes from the plantar fascia, from the soft tissue. And honestly, you cannot physically break down, doesn't matter which shockwave you use, you cannot go and break down the heel spur with a shockwave. What's going to happen is once you start with the regeneration, your body will start cleaning up whatever has been deposited extra there.
Probably with power of lithotripta, you can physically
exactly
destroy.
That's different story, but you have to go in the hospital, you have to go under
we
anesthesia.
are operating the devices which are absolutely safely designed to use on humans' body without any destruction. Do you agree?
Exactly. Yeah, I agree. This is like an office use, like lithotroper for kidney stone and the shockwave that we use for healing the MSK, they're completely different. Like the power of lithotroper is like at least 100 times stronger. Like it's, I think I had somewhere a video, like, I don't know if I can find it now, but just to show the difference between like the applicators, the coil, it's pretty much what the head that, yes. So the head that is generated inside there, it's, I might have it on the I Love Shockwave, but let me just, actually, this is a really good point. Just give me a second here, okay? So I'm going to show you a picture, the difference between a lithotroper coil and the shockwave that we use, okay?
There you go. You got the picture there.
Yes, but okay, so this is the main device, but now I'm going to show you even more precise picture. Okay, Igor? Like, look at this.
Yeah.
So this one, this is the coil that we use in the clinic for shockwave. And this is what is used for kidney stone. Like, look at the difference.
Do you need to press anything?
Do you see anything on the screen?
Well, it is loading. It tells Yuran Berisha has started screen sharing, but I don't see anything apart from your picture.
Okay, I think the computer froze here.
Never mind.
Okay, I'll see how we can. The internet connection is probably low, but anyway, let's probably the sound is recording, and once this, now do you see anything?
Just 1 second. Yeah, I can see your picture. I can see your side.
Yeah, look at this. For example, this is what we use it in the clinic, and this is what is used.
You are showing the coil.
The coil, this is what produces a shockwave. Like, look at how much bigger is shockwave to break down a heel spur or like calcium buildup versus the small one here. Okay.
Yeah. And let's cut the long story short and end up for today.
Yes.
So please tell some words to Ukrainian patient who would like to go and try shockwave therapy, but hesitating or worrying too much.
Honestly, Igor, it's if somebody wants to truly heal themselves and not just to treat the symptoms, they definitely should try shockwave therapy, because the first thing is you're not hurting anything else, and it's going much deeper than any other modality. It's like 3 to 5 sessions, and you're stimulating healing. You're not just covering symptoms. Okay, so anybody that has been in chronic pain, what I say for my clients, or what as a clinic we say, anybody that has been in pain for minimum 3 months and have tried any other form of therapy, or thinking about surgery or thinking about joint replacement, they must consider shockwave first, especially the combination, the true shockwave and the radial pressure wave. And that's where you get the maximum results. It's
at the end, just present yourself, who you are and where you're working.
yes. So I'm Uram Berisha. I actually have 3 clinics. I have 2 clinics in Canada, and then one I have in Kosovo. We do shockwave. I teach shockwave therapy. I've done over 50,000 treatments with shockwave. So I teach actually other practitioners in shockwave therapy, like hospitals and medical doctors and all that. So we do as a clinic about 20 to 25 shockwaves a day. And I have clients from all over North America. There are people that fly in for the treatments from other places because not many places offer the combination. A lot of places, they only offer one or the other. So when you combine those two, that's where you get the best results.
When you say those two, you mean radial?
The radial and the focal.
So radial is not a real shock wave, it's a
No.
radial pressure wave.
It's a kinetic pressure. It's more a pounding, where the
And
shock wave
focus,
is pure
a
sound.
proper shock wave.
Correct. Correct. Yes.
Well, I have done, the official part is over, and let's start an unofficial part. Do you have time?
Yes. Yes. Okay. I'll just